Good evening. My name is Joanna Barudi. I want to welcome and thank you for making the time to join us this evening to the ALS Association Greater Chicago Chapter's Living Well with ALS webinar series. For those of you who are new to us tonight, this program is one installment of a series of webinars offered quarterly intended to bring practical and useful information to those living with ALS and their families. Tonight's program will focus on intimacy and sexual health. This topic, for many reasons, is often dismissed and not brought up in a clinical setting. But intimacy and sexual health are important parts of everyone's well-being. Before we get started and before I introduce our amazing speaker, I would like to quickly go over a couple of housekeeping items. Everyone from the audience will be muted by default throughout the session to reduce static noise. You are welcome to use the Q&A tab on the bottom right side of your screen to type in your questions. We will go over them at the end of the program after the presentation is completed. If for some reason we do not get to all your questions today within the allocated time, we will follow up with the answers via email. A recording of today's session will be available at a future date. All who have registered will receive notification via email. Now, our speaker tonight is Ms. Joanna Nunez. She's a lady with many talents and expertise. She's a licensed clinical social worker with the North Carolina chapter of the ALS Association and has been with the chapter since 2012. In addition to the wealth of expertise she possesses, she also has experience in both substance abuse and trauma. She is also very talented and a published writer. She was a featured speaker about tonight's topic at the International M&D Allied Professionals Forum, which was held at the in San Diego this past December. Joanna, thank you for joining us tonight. The mic is yours.
Thank you so much for that lovely and hard to fill introduction. So I hope I meet everyone's expectations tonight. If you see me glancing, it's just because I have dual monitors and I don't want to ramble. And as you'll learn, my background or my first job out of grad school was the Department of the Defense. And if you know anything about them, they try to kill you with PowerPoints. So I have a PowerPoint presentation, but I am not going to read from it. A lot of it will be just information, stories, and of course, I welcome your questions. And all right, I think we're good. I think we should hide me, but we'll see about that. So just a few things that Ms. Barudi didn't mention. I don't have any disclosures to make. I'm not selling anything. This is completely just one ALS chapter coming to talk to another ALS chapter and all their pals and cows. I am not a doctor, so even though I'm going to be talking about some medical things, of course, if you have any medical questions, finding the right person on your clinical team, and we'll talk about that in a little bit, to ask would be preferred. And I will give you my humor warning. Okay, so there's two parts to my humor warning. My humor warning is one, I think I'm really funny, and I can't see you guys, so I'm just going to pretend you're laughing when I make a joke. And two is I deal with stressful things. As you heard, I specialize in trauma and substance abuse. I've worked with the Army veterans here at Fort Bragg, Army active duty and Army veterans for over 12 years now. We have a crazy sense of humor. So please, if I make a joke here or there, please don't think I'm making light of ALS. Please don't think I'm making light of you or your situation. I think it's, as my one grad professor said, sometimes you have to laugh so you don't cry. And I kind of live by that, and my team puts up with me and my crazy humor. So again, I don't mean to be irreverent. It's all PG stuff tonight, nothing like that. So let me get started. Oh, I should have had that up before. Sorry. Just wanted to show you guys, everybody always says, put up a nice professional picture. Well, that was me doing the ice bucket challenge when that was big. And I did wanted to disclose that I am not ASECT certified. So ASECT is the American Association of Counselors Educational, the American Association of Sexuality of counselors, educations, and therapists. I was going to do that. And then I found out it was over 300 hours. And I was like, I could get another master's for that. So I have taken about 60 hours of CEU specifically on clinic sexuality, but I am not an ASEX certified person. I just want to always make that clear. And now we can move on. So what good would I be if we didn't define intimacy first, right? So I wanted to just make this, not quite your textbook definition of things. So we will start with the textbook definition. So Webster's definition is, it had a few: close familiarity or friendship, closeness, such as intimacy between married partners. It also could be private or a cozy atmosphere, like an intimate table for two. You guys are in Chicago. I know you have wonderful restaurants there. You can, at a lot of fancy restaurants, you can ask for what is called an intimate table, and that's exactly what it is. Often you sit side by side as opposed to across from each other. So intimate can mean a space. It can also mean an intimate act, and you know where we're going there, such as the relationship escalated to intimate acts. And it can also be an intimate word. So shared intimacies with a stranger. So that's Webster, okay? So then I just asked adults, like I asked people on my team, I asked people at clinic, I polled just random people I met on the street. How do you define intimacy? And I was told closeness, togetherness, being married, knowing each other without having to speak, knowing what the other person is thinking and how they are feeling. So then I asked high schoolers, and I have a friend that's a high school English teacher, and she didn't mind. This is their responses: like doing it, being together, being exclusive, and being more than a social media thing. So if I don't think Facebook is cool anymore, but if it's, you're in a Facebook relationship, it's more than that to be intimate. I have a cousin who teaches preschoolers. So I asked him if he could ask about love, because obviously we don't want to ask preschoolers what intimate means. So they said, we asked him, what does it mean to be someone's Valentine? That's the question he asked them. And they said, give them candy, sit with them, tell your mom about them, be nicer to them than anyone else. So we have all the way from Webster's down to 4-year-olds telling us what intimacy means. And honestly, I think I kind of like the 4-year-olds version the best. So when we think about intimacy and going and talking to our doctor about, like personal, intimate questions, you might be thinking, well, Joanna, we know how the birds and the bees are made. And if you don't, that's okay. You can private message me. I will again, not a doctor, but I'll get you to someone that can talk about that. What we do know about ALS is it doesn't inhibit conception, pregnancy, or birth. This picture up here is of Carrie Brown Still. And please pardon my Southern accent for you people in Chicago. Carrie Still was a wonderful woman. She had 2 master's degrees. I'm so sorry. I forget how sensitive my mouse is. She had 2 master's degrees. And in 2005, like late 2005, newly married, she started getting foot drop. Some of you, unfortunately, might know about foot drop. So she went to the family doctor. Of course, the family doctor ran a gazillion tests, and they couldn't come up with an answer. So, you know how it goes. She went to orthopedic surgeons. She went to, she went, of course, to neurologists. She went to everybody and anyone under the sun. And they finally misdiagnosed her with like a virus that was causing paralysis. They couldn't name this mysterious virus. They just told her, because it's affecting one foot, you have a virus. We can start treating you with a bunch of antibiotics and steroids, and hopefully you'll get some movement back in your foot. Well, miraculously, in early 2006, she did start to get some movement back in her foot. And she thought, well, that was weird, but that's over. Like, thank goodness. She then found out she was pregnant with, like I said, they were newlyweds, with their first child. And unfortunately, as her pregnancy progressed, and you know how it is when you're pregnant, they're going to blame everything on the pregnancy. She found herself getting weaker. She found herself not being able to do her job, not being able to stand for very long periods of time. And unfortunately, by the time her daughter was born, she was fully into ALS, correctly diagnosed with ALS, and she was already wheelchair bound. She died when her daughter, Kelly Lynn, was 10 months old. So when she was giving birth to her daughter, she was actively in probably stage 2 or stage 3 of ALS. She was, unable to walk, paralyzed pretty much from the waist down. So I just want you to know, like, ALS is not birth control. Okay. If any one of us are still young enough to have babies, ALS is not birth control. It doesn't prevent conception, pregnancy, or birth. And the Carrie B. Still Foundation, which her parents started after her passing, is a wonderful, wonderful foundation. I don't know if they're going to make these slides available for you, but that's a clickable link. And like I said, she's just a wonderful person. So learn more about her if you can. So let's talk about sex for a minute, okay? I wanted to name it that, but I didn't know that was the name of it in San Diego. So let's just talk about it for a minute, because I know it's awkward. Let's just get that elephant out of the room and talk about it. So I said it's awkward, but some of you might be looking at me and shaking your head and saying, Joanna, it's not awkward at all. Like, I talk about it with my doctor. I talk about it with my friends. I talk about it with social media. And that's great. I can't see you right now. And even if I could see you, I could probably get 20 different answers. If I asked you, raise your hand and tell me if your family was super comfortable talking about sex. Raise your hand and tell me if you never talked about sex in your family. That's just something that is going to be based by religion, by culture. I'm from the South. I grew up in the South. I'm in the Bible Belt. We don't talk about sex here very often. Like, if we do, it's very hush hush. It's behind closed doors. Like, it's okay for you to have, say, your girlfriends over or your friends over and talk about it. But a lot of people don't regularly think, oh, I could ask my doctor about that. And I put one of my clinics, I won't say which two, because I work at 2 ALS clinics in North Carolina. I asked one of them. I was working on this presentation, a very similar presentation for San Diego, like Ms. Barodi mentioned. And they asked me what I was doing in clinic. And I said, oh, I'm working on this ALS and intimacy presentation. And they went, oh, that's really good. That never comes up in clinic. And like, I don't think they've done enough research on that. And I was like, yes, that's true. All these things you're saying is true. So how are we as a team going to make sure that our pals and cows that come in can openly talk about sex with us if they feel comfortable? How do we project that to them? How do we, maybe short of wearing a button that says, ask me about sex, how do we project that? How do we feel like, we project that we are not going to judge you. We are not going to look at you funny. We're not going to roll our eyes at you. We're not going to snicker. We're not going to gossip. And I was telling them some ideas I had. I said, well, these are some things we do in the substance abuse world, right? Because when you ask somebody, how many drinks do you have a day? They can be a little bit like, I don't know, like 2, 3, like, what's the right answer? So you kind of like what we call backdoor the questions, okay? It's never, do you drink? It's how many. You try to make it, and you might even throw a number out there. Like, I might say, do you drink 3 or more drinks a day? Because like in their mind, 3 sounds like, oh, she threw 3 out there. I said, let's take that with sex. Let's put that on a form somewhere. Like, I know you guys hate forms and your clinic days are so long to begin with, but while you're hanging out in your room, waiting for one of us professionals to come in, we could like slide you a little form. It could say things like, talk to the doctor today about pain, talk to the doctor about sex, talk to the doctor about sleep issues, talk to the doctor about incontinent issues, talk to the doctor about foot drop. I mean, we could list everything on there that's an ALS symptom and not an ALS symptom. And I would want to know, and feel free to put this in the Q&A if that's okay with everybody, would you be more likely if that was just on a form? Psychologically and scientifically, we know that if we put it out there, you're more likely to talk about it. So I went to my group, remember, Eastern North Carolina, very rural. And I said, I have a form, guys. I created it. Okay, I tweaked it off the internet, but I created it. And we're going to, like, can we just get this? Can we slap the ALS clinic name to the top of it, throw it on some letterhead, and we can start asking these questions, like check here if you need to talk to the doctor about this. And I've put sex in there, but you know, it's nice and hidden. And I will quote one of my coworkers, a clinic member, not a care service team member. I declare, I don't know if we should be talking about that in clinic. So I smiled and I said, that's exactly what we're going to be talking about in San Diego, is how to be more approachable to our patients, how to let people know that they can talk to us. I'm not going to judge her, because my guess is she grew up in Eastern North Carolina. She is probably very like religious, in a religious household where they don't talk about that. And I'm not matching religions, because I'm sure there's religions where they openly talk about things like that. And just her personal culture didn't feel comfortable with that. So I threw it out to the whole team. I said, okay, I'm going to embarrass you. I'm going to put you guys on the spot. They probably hate me now, by the way. I said, how many of you, like, raise your hand, how many of you would feel comfortable talking with a patient about intimate matters? I was looking around. I'm like, OT, like, you have props, you have pillows, you have aids, you have, you know, you can tell people how to go to the bathroom more safely. Can you tell them how to have sex if that came up? And it's an awesome OT, I'm gonna let you know. And he's like, no problem. We have pillows and supports and lifts and everything you can imagine if that comes up. And I was like, cool, like, that's good to know. And so I challenged everybody at the San Diego meeting, and this was worldwide. Okay. So when we look at culture and ancestry, the European people, they might be like, we're already talking about that, Joanna. But I challenged every doctor, every clinical person that attended that meeting in San Diego to please do what you need to do. If that's, you know, you don't have to be the sex guru. There are sexual therapists, those asect people, of one of which I am not. They are happy to come in and do clinical consultations. You can get your team, like, not you guys, they're pals, but your clinical team can find one of those people, and they will come in and they'll answer questions. They might give some tips to the OTs, the PTs, the respiratory therapist, anybody that kind of has a hand in this game here, right? Because that's what it's going to be. It's going to be a team matter, and we want you to live your life how you want to live your life. We don't want sexual and intimacy to be prohibited. Check my notes so I can make sure I don't. So I'm dating myself. Okay, we'll just say like 40 something. I remember seeing this lady on TV in high school, and I was like, why is this old lady talking about sex? And she only came on TV really late at night. But it's Sue Johansson. She was called the Canadian Sex Grandma. I was not allowed to watch it. Shout out to Mom if she's watching. And honestly, I think the one or two times my friends and I snuck and watched it, like at a high school slumber party, it was kind of boring. It was very like, you're going to do this, and this is going to cause sexual arousal. If you are not getting sexually aroused, talk to your doctor. So it wasn't like the X-rated porn stuff I thought it was going to be. And now as a professional, I realized she was really groundbreaking. She was telling people, hey, this is just a normal part of life. Don't be embarrassed. Ask questions. None of us are going to judge you. We're not going to look at you like you're stupid. We're not going to look at you like you're weird. We just want to help you. And she says, we're sexual human beings. So why aren't we more sexual? Why is that not a part of everyday conversation? So something, when I was doing research into this, because it wouldn't be right to just come up here and talk for an hour, although I feel like you might be thinking that, I did a lot of research. And one of the very interesting things I found when I was doing research is there are not a lot of studies on ALS and intimacy. So I first thought, well, I can see that. Like, what do we care about when you're diagnosed with ALS? We want to keep you alive longer. We want to keep you breathing. We want to keep you eating. Like, we need that nutrition coming in, whether it's orally, a feeding tube. We need to keep you alive. And that's sex. Like, sex is way down there, right? Well, actually, sex is not way down there. Sex, if you remember, if you can think about where sex fits into what we call a pyramid of need, it's actually right there with food, shelter, and comfort. So it's one of like the 4 basic things that psychologists believe humans need to feel safe and secure. So it's down there. So throwing this up here, what I did find was that there were some studies done that weren't about ALS and sex. They were actually about caregivers of people with ALS, or as you guys might know, we call you guys CALs. So they were looking at just like caregiver stress, caregiver burnout, and somehow intimacy got in there. Well, duh, because what did I just say? Sex and intimacy should be a part of our regular everyday life, right? So one of the things they took a note of is when we put on that hat of caregiver, whether you're a partner of the person with ALS, whether you're an adult child of the person with ALS, whether you're just a friend of the person with ALS, it can kind of blur our other relationship, right? So you might hear people say, I'm a wife and I'm a mother, but I'm still Joanna. I was Joanna first. Okay. So if you think of like somebody that has ALS, they were a wife and a mother first. They were a partner first. They were a spouse first. But now we throw ALS in there and caregiver goes to either their partner, their adult child, like I said, a friend. It kind of trumps everything else. Like, well, this is my wife and she has ALS and I take care of her. And I'm not saying that's wrong, because of course you love that person and you want to take care of them and you want to give them the best care you absolutely can. But does it kind of feel weird when you're doing, like we said before, an intimate act on them? And I don't mean a sexual intimate act. I mean like maybe changing their underwear because they can't do that for themselves anymore. You might not look at that person and think like, damn, they're sexy. You might be thinking like, oh, like I have to change their underwear and then I have to do laundry later and then I have to make dinner. So it becomes this stressful thing. And if this is not describing you, great. Please share your secrets at the end of this. And pals, I know you're out there. Something I tell my pals all the time, please don't feel guilty. I will share a story because I'm hoping my team's watching and they tell me they like my stories. So I started with the chapter in 2012. And I started just as a support group person. That's what we call an outreach professional. So I did these every month. Can you imagine people listening to me every month, right? And this was pre-COVID. This was 2012. So we actually did this in person for like 2 hours once a month. And it was fun. And I had snacks and I tried to make it as open and friendly of an environment as it could be. And we had this couple, and she has since passed, but I will call them M&M for privacy reasons. Her first name started with an M. His first name started with an M. And I know my team that was with me back then, they would laugh when they would read my notes, not because I was making fun of them, but I would say M&M got into another fight at support group and I had to redirect them or try to change the subject so it didn't become a brawl. Not a physical brawl, but they would get a little snippy with each other. And then like I said, I wasn't on the care services team, but I was talking to one of their doctors, right? Just had a question, talked to their doctor. And he said to me, oh, M&M, yeah. If that's not the picture of in sickness and in health, I don't know what is. And I was kind of dropped the phone. I was like, are we talking about the same M&M? Like last name this? I didn't say that, but I was just like, oh, well, what do you mean? Because I only see them like once a month at support groups. And he said, well, I know you know how long our clinic days are. And I was like, yeah, absolutely. And they lived in Fayetteville at the time, and they traveled to Duke, where with Dr. Bedlock was their doctor. And so that's about a 2-hour drive. So they had a 3 to 4 hour clinic day plus a 4-hour commute. So very long day. And the husband worked full time to pay for her care. So he said, well, sometimes they get hungry. And he always brings all these snacks with him, like his beef jerky and his peanuts. And then he like eats it. And then he looks over at his wife and he goes, honey, are you hungry? And he pulls out from his pockets, because like a guy, he's not going to carry a bag. Okay. I want you to picture Southern NASCAR, like man's man. Okay. And he would say to her, honey, are you hungry? And like from his pocket, he'd pull out like one of the little applesauces. And this was before we had those cool, like squeeze up applesauces. So he'd pull out like little Mott's applesauce, and they said he would hand feed her, and he would run and get her a soda. She was a Pepsi girl. That he would run and get her a soda, and he'd have a straw in his pocket, and he would just make sure all of her needs were met while they were waiting to see the different professionals. And again, I was like, same people, right? But that just, I was like, oh my gosh, if that is not the perfect example of in sickness and health that Dr. Bedlack just shared with me, I don't know what is. And I kind of called them out at a support group afterwards. I said, I just wanted to let you know that Dr. Bedlack said some really sweet things about you guys. And the husband said, well, that's when we're at Duke, we have to be on our best behavior. So I guess I never got to see that side of them. But I just wanted to emphasize that, because I don't want anyone to come on here and feel guilty. And I'm hoping your other support group facilitators tell you this too. It is for sickness and health, or if it's your adult child taking care of you, or your next door neighbor, or your best friend, they're doing it out of love. Okay, I know I sidetracked there. So just jumping down to the next thing, there are intimate and necessary functions that need to be performed for your quality of life, okay, for the PALS quality of life. And here we're talking about intimate and necessary, not as a sexual intimacy, but like I said, changing your underwear, wiping your bottom, feeding you. That's kind of intimate, right? Like, think of a mom feeding her baby. It's all fun and like airplanes and like food getting thrown back on the mom or the dad or the big sister. But when we're talking about like, hey, I need to help this elderly person, or I need to help my spouse because they no longer have wrist and arm movement, it's kind of intimate. You're kind of looking into their eyes. You're, I hope you're not just doing this, like eat. You're like, you're connecting with that person. And I think that's important. One more story before I go on. Also, they told me I had to fill up an hour. So support group person, right? So when I was doing the support groups in person, and then I took over pre-COVID again, one that we called our ALS telephone and online support group. Well, now, of course, they're all online and virtual. But back then, before COVID, we had 8 or 9 in-person support groups, and we have one that I ran that was meant for anybody to call in. You could maybe be in an area where we didn't have an ALS support group. Maybe you wanted an extra one every month. So people would call in or Zoom in like this. And one lady just always put her first name. And, like, it's kind of our job to know who people are. So I always kind of play 20 questions like, oh, like, I don't know why I just wouldn't come out and ask her, like, who's your pal? It was just very obvious seeing her on camera that, she didn't have ALS, and she was always very quiet. She didn't really talk a lot. So I figured she was somebody's Cal. And I finally just asked her one time, she had left her email or given her email with somebody else. So I emailed her and I was like, I'm so sorry. I've seen you at a couple of these support group meetings, and I'm not sure who you are, or if you have a pal, or if you're just somebody that's interested in learning more about ALS. And she said, oh, my ex-husband, Kevin, has ALS. And I was like, oh, I'm so sorry to hear that. And she said, we share three daughters. They're all like 16 and up. He's remarried. I'm remarried. We're friends. And I just want to be here and be as supportive for him and the girls as I can be. And I just thought, like, wow. And she said, if he never got ALS, we probably wouldn't have this relationship. She said a lot of things changed when he was diagnosed. And of course, you don't wish ALS upon anybody. But I thought, when I was talking about wearing the different hats, and you can't look at your wife as your wife anymore, you see them as the person you take care of. Where you can't look at your mom as your mom anymore. You see the lady that needs assistance. So she was looking at her ex-husband that she didn't have the best feelings about, and he was ex-husband. And then she saw him as this vulnerable man that needed help. And she was able to set aside any feelings. They talked it out. They worked it out. Didn't get back together. I must emphasize that. They were already both remarried. But they were able to kind of co-parent and have a life that included everybody in his final years. So I thought that was super touching. And I thought it was like, wow, that's great that they could do that. So I think I already kind of touched on this, but the two studies that I looked at were about ALS and caregiving, not really ALS and intimacy. They found two things, and these are like very fancy words, okay? The first one says that there's a correlation between the loss of intimate acts and intimate feelings, the more strain there is. All that means is, as you take care of your partner, if it's your partner with ALS, the more you have to do for them, the less. Okay, so we call that an inverse correlation. That's a very fancy word, go use it. All it means is one goes up, the other goes down. Okay, so as I need more help, my husband finds me less attractive. And this is not everybody, okay? This was a study that they did in 2006, so things have changed. Same people, Goldstein and colleagues, they did another one on stress in ALS caregivers. And I thought this was pretty interesting because it just kind of invalidates everything I just said about Kevin and his wife. They showed that how your relationship was pre-diagnosis was going to be a pretty big predictor of how your sexual intimacy and love relationship would be once you were diagnosed. So if y'all were great before the diagnosis, you're most likely going to be great throughout and after the diagnosis. If you're fighting a lot, this is just another big stressor. I mean, if you think about it, right? Like you might fight about money, you might fight about the kids, you might fight about chores, you might fight about going out too much, something like that. You fight a lot, some people. And then now you have a really serious disease thrown on top of that. That could break some people. Or like in Kevin's case, even though it was with his ex-wife, it totally revamped their relationship. Some people have told me we were not doing that well, but when this person got diagnosed with ALS, I realized I didn't want to lose them. And I realized like my foot was out the door. I was about to call the marriage off. I was about to call the relationship off. And I just realized like, no, I want to be in here for the long haul. So I think that, even though, again, that goes against what Goldstein says. Now, remember, these are studies. I think this was 34 people, 34 couples that they interviewed, or caregivers that they interviewed, where the caregiver was the spouse or partner. So we're not looking at caregivers that are, say, like the neighbor. So unless you have a sexual relationship with your neighbor, and remember, there's no judgment here. So that's fine. So here's the part you probably wanted to hear, maybe what you came for, the dirty, the PG-13. As my high schoolers will say, can we still do it? Yes, this is that part where I'm not a doctor. Remember, very important for you guys to remember that. So this is where you get your whole clinic team involved. We know ALS affects the nerves and the muscles, okay? You need your nerves and muscles to move. So if I'm looking at my partner and think, I want to grab their butt, I want to pinch their butt, my brain might be thinking that. But if I can't make my hand move, or I can move my hand, but then I can't grasp, I can't pinch, well, now we have a disconnect between brain and body. So that would be something I would ask my doctor about. Okay, so I can't do this anymore. How are we still intimate? What do we do? Respiratory. If you're doing it right, it's a workout. Okay, that's all I'm going to say. My boss is on here. I don't want to get fired. But if you're doing it right, it's a cardio workout. Well, let's think about that for a minute. Some people don't have the best stamina. And we know ALS can affect your lungs and your respiratory system, right? So there are some things you just need to talk to your respiratory therapists about, and maybe the doc, just to get his, although, respiratory therapists, they are the subject matter experts on respiratory. So I want to be intimate with my partner. Do I need to wear my BiPAP while I'm doing that? Do we need to schedule breaks? Maybe my partner looks at me and goes, "Oh, you look like Darth Vader and you sound like Darth Vader with that thing on. I can't get there." Cool. Do I work, do we talk to my respiratory therapist and say, can we do like 3 minutes of intimacy, mask break, 3 minutes, how do we make this happen? Okay. It's a new normal. We're going to embrace it and we're going to figure out how to do this. Then we just have the indirect effects. Okay. You're tired. And I'm not just talking about the pal. Now the cow is tired too. There can be lack of sleep with this. I know some of my pals sleep a lot more, but some of my pals tell me it's not a comfortable sleep. They wake up in pain. They can't shift into that right position anymore. So, you don't feel pretty. You don't feel sexy. You don't feel like doing it, as the high school kids say, if you're fatigued, if you're working on like 3 hours of sleep from last night. A lot of people complain about muscle spasms and muscle tightness, and they might even be on some medicine, like baclofen for that. So now we have to worry about like muscle cramps and muscles tightening up when we don't want them to tighten up. Again, things to talk to your clinical team about. And then let's just look at medications to begin with. The 3 R's, Relivrio, Radicava, Riluzole, none of them have any sexual side effects that have been, like something like 6% of people have to experience it before the FDA puts it on there as a side effect of the drug. Well, less than 6% apparently are experiencing sexual side effects from the 3 ALS drugs. But that doesn't mean there aren't other medications that you're taking. I just mentioned baclofen. Baclofen can help with muscle spasm. It's a muscle relaxer. Muscle relaxers can also make you really tired. Maybe you or your partner, your caregiver is on like Paxil, Prozac, what we call a SSRI, a selective serotonin reuptake inhibitor, a happy drug. Well, they make you happier, but you know what else they do? They kind of tank your libido. Blood pressure meds can mess with your libido. Things like just all these things we have to think about. Talk to your doctors, talk to your care team. I'm going to call out all the social workers here. I'm probably going to get some hate mail here. Social workers should be comfortable talking about this, okay? If you don't know who to start with on your clinical care team, but this needs to come up, like, talk to the social worker, okay? And like I just said, we've got effects on the partner, okay? They're tired, and this is assuming, even if the partner is not the main caregiver. Remember my M&M story with my burly Southern NASCAR guy? He worked like 12-hour days. So the person with ALS, his wife, she had an in-person caregiver. Like they paid out of pocket and insurance helped a little. So she had like 8 to 12 hours a day of caregiving. And then they had a night person that came in, I think, for like 6 hours at night to help her adjust and, things like that. So he was not the main caregiver. He was her spouse, he was her husband, he was her partner, but technically caregiving was left to like the medical professionals. That doesn't mean he wasn't tired. That doesn't mean he didn't help out here and there, or somebody calls in sick and now he is the main caregiver for today or for this shift. We've also got some grief and fear going on, right? Talking about losing our partner. We don't want to think about that, which can lead to depression. And then something that I wanted to mention, and I touched on this earlier with the caregiving role, when we put on that hat as a caregiver, it can actually psychologically shift our brain as to how we view our partner. There was a study done in the early 2000s, and they've repeated the study and repeated the study and repeated the study in hopes to help women. It has nothing to do with ALS. It's called postnatal, so after birth, postnatal Madonna syndrome. Okay, Madonna as in not Madonna like material girl with the boobs, Madonna like Jesus's mom, Madonna. Okay. And what they have found doing this study and going back in time all the way up to present day is a lot of male partners and some female partners will view the mother of their child as this like pristine person that they can no longer have sex with because she's no longer like my girlfriend or my wife or my side chick, she's the mother of my child. As you can imagine, this can cause a lot of problems, right? Like, hello, I still have needs. Yeah, I might be a mom, but I have needs. Well, my partner's over here looking at me like, I can't get her dirty. She's too perfect. I love her. She's the mother of my children. This has an indirect effect on the caregiving role. Okay. So you're not, this person is not your mother, but you're looking at them and maybe as your patient. Or like I said, the person that you take care of 5 hours a day. They might stop being your husband, your partner, your spouse. They might now be Ed with ALS. And that's where you talk to your social worker. That's where they can recommend a therapist. That's where they can do some clinical therapy if they're licensed to. And we get you in with that expert that can help you with this, because it's here's me, I hate the word normal, but it's normal. They've done studies on this. Not so much so they took that Madonna syndrome and they have reached across, not to ALS, unfortunately. There's not a lot of money in ALS and intimacy research, but they have looked at it in cancer caregivers. They've looked at it in Alzheimer and like COPD caregivers. People lose the sexual role when they are caregiving at times. So this is something that's important and something to be talked about. So one of the definitions I gave you at the very beginning, which was a Webster definition, was intimate acts. Okay, so intimacy can mean an intimate act. It doesn't have to mean, which can be sex, or it can be holding hands. It can be wiping a little ketchup off their face with a napkin. Okay, that can be an intimate act. So caring for a person, if you think about it, is an intimate act. Again, if it's your neighbor caring for you with ALS, it might be a different kind of feeling than your partner caring for you, but it's still intimate. And I don't mean, again, two ways to say intimate, right? So let's redefine this. Let's look at what can I do? What can we do? Doing it, as the high school kids say, might be out of the question. All right. Maybe you just can't do it anymore. So what can you do? Can you lay in bed together? Maybe you're I threw that bottom picture down, bottom middle, because I thought about it like a lot of people are in separate beds when ALS kind of comes into the picture, because we have BiPAPs on. We might have a trach. We might have a feeding tube. We might have all these things that that king size bed is not looking as restful for the partner anymore. Or maybe you're lucky enough to have an overnight caregiver, like a medical overnight caregiver. Well, that's time for your partner to rest, or whoever your caregiver is to rest. So if you've got this, let's say CNA that sits right outside your door to listen if you have any needs throughout the night, something we need to think about is, should the partner be in another room to get a good night's sleep? Well, yeah, but then we lose that intimacy of sleeping next to each other, right? So I like that picture, like they're holding each other's hands, even though they're in separate beds. Can we just snuggle on the couch and watch a movie? Can I sit on your lap in your wheelchair? Can we dance in your wheelchair? Can I just sit across from you and look in your eyes? These are things that are now going to be the new normal and ways to recreate intimacy without necessarily doing it. But it's okay to do it. Just talk to your clinical team first if you need some help. So one more story. Okay. There, and I'll use her name. Actually, I've forgotten her husband's name. They were very young when her husband got diagnosed with ALS. They were like a blended family. They had, I believe she had 2 or 3 children from a previous marriage, and then they had a child or 2 together. So a lot of kids. We're looking like 4 to 5 kids here. And second marriage for both of them, but like in their 30s, young people we don't always associate with ALS when he was diagnosed with ALS. And she came to talk to us, all of us at Care Services, to kind of give us a day in the life of a caregiver's experience. And I liked her because she was blunt and she would just say it tell you like it is. And her husband also saw Dr. Bedlack. So one of the things she really stressed with us is we crave normalcy. And she said, before we knew getting married, like extra kids, she said, I got pregnant pretty early on. We knew that this was a full house. It was going to be crazy, that we would have to do something to just keep our marriage like hot and spicy and just have time for each other. And with 4 or 5 kids, that's hard. So luckily, both of their parents lived within like 2 or 3 hours away. So they alternated, and each set of grandparents took the kids one like Friday or Saturday night a month. So they had one night a month for date night. And she said that didn't change when he got ALS. The parents still came, they still took the kids for the night, and they would have, she said, we just, what we did on date night changed. She said before we would go out to the bars, we'd go out for like a nice dinner, then we'd go dancing till they lived in Raleigh, which is a pretty big city. It's not Chicago big. It's pretty big. She said, we'd go out dancing, we'd go to clubbing, we'd go to concerts, we'd go to movies, and we could stay up all night if we wanted to because kids are at their grandparents. She said that, of course, that changed when he got ALS. She said, but we still have our date nights. She said, now we just like order Chinese food in with Dr. Bedlack's permission. Remember, Joanna's not a doctor, so I'll throw this on Dr. Bedlack. Dr. Bedlack gave him permission to have 1 beer through his G-tube. If any of you know, he had to get that beer flat first, because if you put bubbles through a G-tube, it is not a happy experience. So he would sip it at first, but when he couldn't drink anymore orally, she would like crack that beer at noon, let it get flat, and by like 8 o'clock at night, they were having a beer together. And she said they did that literally up until he passed away. So 1 night a month to make sure that you are still a couple. 1 night a month to make sure you're talking to each other and spending time with each other. And you can make rules about this. We don't talk about ALS, or we talk about the kids and ALS for the first 2 hours and then we don't bring them up anymore. However you need to do this to recreate intimacy and to make your partnership continue to grow. Because I think that would be beautiful if you could say, like, we were married for 24 years and we were together and in love the whole time. So all of that to say, and I picked a different clinical team because I didn't want to focus too much on North Carolina. You'll see my care services team in a minute. This is the Indiana clinical team for the VA Center of Indiana. And poor people, they did not know that they were going to be in my presentation tonight, but public domain, va.gov published it, so I'm allowed to put it in my presentation as long as I give proper credit. So this unsuspecting team is here to help you, just as like your possibly unsuspecting team is also here to help you, okay? And I say that jokingly, but we're all medical professionals. We all might have different letters after our names. We all might have more schooling. Some people might have 4 years. Some people might have 8 years. Some people might have 12 years. There should be no judgment when it comes to this. And we want to help you. And like I said, with my Southern team, I told them I'll bring in a sex expert if that makes us feel more comfortable. If you're like, well, I don't know how to answer it, because that might be some of the fear, right? Like you as the patients might be thinking, well, I don't want to ask that. My doctor will think I'm dumb if I ask that. And we as the team are going, oh God, please don't ask that, because I don't know what to tell them. Like they'll think I'm dumb. So let's just take that dumbness out of it. Okay. There's no dumb questions. And if my answer is, I don't know, I want to help you. I don't know, but let me find you the right professional that can, whether that's somebody on the team, or we have to bring in a sex therapist, or we give you a referral to someone that just knows what they're doing and is super comfortable talking about this. And through these resources up here, Enabling Romance, A Guide to Love, Sex, and Relationships for the Disabled is written by Ken Kroll and Erica Klein. Ken has, I believe he's still alive. He has a neuromuscular disorder, so like MND, not quite ALS, but this is written by a married couple telling you how they get through life. with this disease and how they're still intimate, how they still have time with each other, how they still make time for each other. And yeah, you're like, okay, Joanna, easier said than done. So I'll leave it to Ken and Erica to tell you how to get it done, because they're living it and they've been through it. And again, I'll make sure you guys can get all these resources. Near the bottom, the sexual function and the sexuality and chronic illness, that's more for professionals, but hey, take a stab at it. You know, like read it if you want to. Just throw it up. I have to like put that in there. I did not copy Goldstein's work. I want to give him credit, them credit. And this is, I promised them that they would be in there. They gave me clearance. This is my awesome care services team in North Carolina. Okay. We were just on a retreat and our boss bought us these awesome blingy glasses because she wanted us to know that we were seen. See me. So that's my thing for you tonight. Please take away is there's no room for judgment when it comes to the helping professionals and medical professionals. If you feel judged, talk to somebody. Say like, hey, I went and asked, I'll pick on the social worker since I'm a social worker. I went and asked the social worker about this and I felt judged. Someone on your team should do something about that, both towards the social worker, and then they should also find you the answers that you need. But teamwork, like I'm not going to do the teamwork makes the dream work, because that's, you know, it's overdone. But teamwork as a pal and a cal, teamwork as your care services team, teamwork as your clinical medical team. That's really who's here to help you. I wanted you to have my information. Please don't be shy about sending me questions. Again, I will stress, not a doctor, not an ASEC professional, but I can definitely direct you. If I can't answer it, I will direct you to somebody that can answer it. And unfortunately, right now, our phone numbers are only voice. So I understand that like a lot of my pals love to text. So please don't text that number because I won't get it. Please feel free to send me an email instead if that's your preferred method of communication. I actually like emails because I can answer them in between calls, but if you need to call me, that's no problem too. Now I'm going to stop sharing and I'm hoping Ms. Barodi will hop back on here. Oh, she's right there.
Well, thank you so much, Joanna. This was amazing. I appreciate all the information you shared and the sprinkle of humor that you shared with that as well. So we're going to have a little bit of time for some questions. We do have one that came through, one that we're going to answer live, hopefully. It's from Joseph. He asked, the question is, can intimacy be a bond?
Yes, intimacy, I would say bond, right? Like B-O-N-D. Okay. Intimacy, absolutely. I would say it's one of the strongest bonds, right? Because I always tell my friends and my patients and everybody, I love a lot of people, but I love them in different ways. So I'm very excited about this. I get to go see him in a couple weeks. I have a 20-month-old nephew. Okay. I love him. I love him to pieces. Aunt Joanna spoils him a lot. But that's very different than the way I love my husband, which is very different than the way I love my best friend, who I've been friends with since like 2002. So absolutely, it's a bond. And I feel like it's one of those things where if you need to bring a therapist or a professional in to strengthen that bond, we're used to that. Speaking as a clinical person, we are used to that. One of the reasons, and I'm sorry, I'm answering long. One of the reasons I explored that ASEC certification was because I got all my grad work in trauma and substance abuse. And that's what I was getting my CEUs in as well. Because, you know, we have to take so many CEUs every few years to keep our licenses. And darn it, if every couple that came to see me didn't bring up sex at some point. And it might have been really low on their list of problems, or it might have been the number one problem. And I thought, like, I'm not prepared. Like I took a couple of undergrad classes in human sexuality and the psychology of sex, but I don't have any clinical classes under my belt to answer these questions that come up in almost every session. So don't think you're the oddball. And I always tell my patients this, you cannot surprise me. You cannot shock me. I've heard it before. And just when you think I haven't heard it, trust me, I've heard it before. you shouldn't upset anybody if you ask a question. And definitely, so long answer short, it's absolutely a bond, and it can be strengthened and it can be weakened. And that's what you're going to work on together with your partner, is strengthening that bond throughout your whole relationship.
Okay, thank you. We have another question from SC. The question is, how many studies have been done about intimacy and ALS?
So when I set out to do this for San Diego, it had to be like fancy. I looked that up. I used 5 or 6 big libraries to look this up, and there were actually less than 30 studies done. And I've kind of alluded earlier, well, that makes sense, right? Like sex is going to be on the bottom of the list when we're thinking about life-saving measures. But then just some search, how you can get down a rabbit hole when you're searching for things. Some search led me to other results that showed me that there have been a lot of studies done on intimacy and cancer survivors and cancer patients. And there have been millions of dollars directed to cardio rehab programs for making patients that have had a heart attack as they're doing their rehab to get back to like normal life. There's a sexual component to that, because we don't want a person having a heart attack doing cardio, right? And we said sex is a cardiovascular exercise. So I was kind of upset, like, because I'm this big ALS advocate, right? Well, if we're giving millions of dollars to heart attack patients, which is great, got my hearts and my red for Women's Heart Month, shouldn't we also be looking at that for ALS as well? So under 30, and I'm hoping to change that.
Thank you. I have one more question about how do you manage or combat the psychological effects of ALS and self-image? How do you recommend they deal with that?
Absolutely. And I think when you're looking at almost any disease, there's going to be psychological effects of, do I look different? I know weight loss is often a problem with ALS. I kind of talk about this with my trauma clients, and I think it lends really well to ALS. ALS, unfortunately, is your new normal. So I'll have people with really bad, like combat PTSD, come to me and they'll say, I need to be fixed. I need you to fix me. I need to be like before I went to war. And I'll tell them, I'm very sorry. I cannot do that, because I cannot take the trauma away from you. You've already viewed the trauma. You've already experienced the trauma. What I can help you do is process the trauma and let this be your new normal. Like, okay, I might always be jumpy because I have PTSD, but how can I work with that? And how can I kind of rearrange that in my life? So I have, obviously, you guys know that veterans have a higher rate of ALS than civilians. So sometimes we see these really buff, for lack of a better word, men and women that were like ACE PT scores. They could drag 400 pounds on their back, and now they're suddenly diagnosed with ALS and they can't walk anymore. And you look at them and they have like tiny little arms and legs, when they used to pride themselves on how they looked at the gym and the fact that they could bench press 200 pounds or whatever. So it's looking into the mirror and learning to love the new you. And you can be mad. You can be mad that this is the new you, right? Because you didn't ask for this. But it's psychologically, you talk about psychological distress. If you hate the person you see in the mirror, that's going to make life a lot harder than if you're starting to love the person with all the, you might call them defects or all the flaws, but learning like that's the new me. And it's not the old me. And I'm never, unfortunately, going to look like the old me. But what are some things I can do and I can work with my partner, with my friends, that like new Joanna likes? Maybe I now wear more makeup. Maybe I now get a cool piercing or a tattoo to make myself feel like, well, yeah, that was old me, but this is still like bad butt. I don't know if I'm allowed to cuss. I don't know how Chicago takes cussing. Like, I'm still a bad, what, like I'm cool. Or, I used to love to do this. And this is talking about your appearance, and I'm going to transition real quick. Some of the problems I see with my ALS patients is they can no longer do what they used to do for stress relief. Maybe they used to run, maybe they used to work out, maybe they used to dance, maybe they used to cook, maybe they used to go on long drives. Can't do that anymore, right? So I help them, and my team helps them find things that they can do pretty independently. So that if they're thinking at 3 a.m, I wish I could go like on a drive right now. I'm so stressed. And that's what I would have done prior to this diagnosis. Can't do that anymore. But what I can do is get on my eye gaze and draw pictures. I have an awesome teammate, Lily, who also presented in San Diego. And she's doing some research, and they're looking into some programs, art programs for people that were artists and used to create with their hands, obviously, right? And their whole bodies in a way. And now they're bringing those programs to eye gazes and mouse programs. So even if you can only move your finger a little bit, you can still create kind of like beautiful masterpieces. So I hope that helps. And I look to be frozen. Oh my goodness, that's a horrible picture of me. So I hope you can still hear me. I will say that I'm happy to answer questions.
So sorry.
It's okay.
Okay.
You're fine. I was just gonna say that if that wasn't the best answer, please feel free to email me or call me too.
Okay, thank you very much. I'm gonna add one more question, and then I think if nobody adds any more questions, we can finish early. So what tools would you recommend to help individuals living with ALS use to bring this topic that we said that it's a bit difficult to bring up to the clinicians at the clinic, help them, feel more at ease?
Right. So I would say if one of you, meaning your partner and you, can attend the clinic together, that's great. And ask if you can present it as a team. Like, hey, when we're in with the doctor or when we're in the respiratory therapist, I'm going to go ahead and bring up the fact that we would like to be physically intimate, but we're not sure how to do that. And of course, if your partner is not there, then I would say, I wish you could see my face right now, 100% blame it on your partner and be like, oh, my partner's not here, but they really wanted to ask about intimacy. So if you can just write this down for them or let me take notes, they want to know how we can be more intimate together. And like I said, if you're not sure who to start with, I'm going to throw us social workers under the bus again, but we are trained, and I'm going to say this, I wish you guys could see my face because I use my hands a lot. Most every person you meet on your team is going to be super non-judgmental and open to talking about anything that can help you. But social workers are like, it's beaten into us in grad school to not be judgmental. So even if you said this craziest thing to me, I have a really good poker face. And I would be able to say, oh, I'm so sorry, I don't know how to help you, but I will find that answer for you and I will get back to you. So if you don't know who to start with, of course, talk about it with your partner first, just so that they're not blindsided if they're in the room with you. And then go ahead and either your team social worker, like your clinic social worker, or your care services social worker, if you have one, they're a great place to start.
Okay, sounds good. Well, two more comments. One from Cynthia. She said, thank you, valuable information. And actually, she's the one who recommended that we invite you today.
Oh, well, thank you.
And the other one is from Mr. Yudowitz. He wants to thank you so much and wants to ask if it's okay to share the slides.
Absolutely. If they've made the slides available to you, public domain, I've credited anyone I need to credit, so feel free.
Okay. Well, thank you so much. I think that was the last of the comments and the questions. So we hope that you found tonight's program interesting. I would like to thank our brilliant speaker for taking the time tonight to share her expertise and knowledge with us. And we want to thank you all for tuning in. Before we leave, we would like to remind you that you should be receiving the recording of the program via email. And if you still have any questions that were not answered tonight, please reach out to us and we'll try our best to answer them as soon as possible. Good night and be safe. Thank you.